More and more women are being diagnosed with osteoporosis and osteopenia as they age. It's becoming a huge issue, and there's a lot of misinformation and myths out there about it that we're going to address today. So I'm Dr. Rodney White with Papillion Chiropractic, and in today's discussion we're going to have a little look at how the diagnosis comes about, what you should be doing if you are diagnosed with it, and some of the risks associated with the medications that are there. So osteoporosis and osteopenia weren't even really a diagnosis till the mid-90s when we developed this DEXA scan to check for bone mineral loss and bone density and those kind of things. And the problem when we get these machines that are very, very accurate or very, very good at looking at things, we don't always necessarily understand it. Let's take MRIs and disc issues, for example. MRIs are a fantastic machine for looking for certain pathologies, but sometimes the most common things they're used for, it's not so great. MRIs are very, very sensitive at picking up any disc issue you have in your spine, but some estimates are that 70% of people with no back pain have at least one disc bulge. So if you go and get an MRI of your low back and you have back pain and it shows a disc bulge or multiple disc bulges, number one, we don't know if that's actually causing the pain or not. And number two, you don't know how long you've had it there, and is it just a flare-up of pain or is it a new issue? And this often leads to surgeries and interventions that shouldn't be done. It's the same with mammograms, have a very high false positive rate. I've seen some estimates that up to 80 or 90% of stage 1 diagnosed issues with breast cancer should actually have never even been touched or worked on, and no chemo, no surgery, but the mammogram gave this false positive. Well, it's looking like that might be the same issue with the bone density scans, because what we're doing is making an arbitrary number or an arbitrary goal and trying to fit everyone into that box. But if you're a standard deviation outside of that, then you're being told you have a problem, but that might still be normal, at least for you, or it might be normal for the population. We just haven't done enough to know that. Another big issue with it is that a loss of or a lower bone mineral density that shows up on the scan doesn't actually always equate to weaker bones. Bone strength is different for everyone, and it doesn't always matter what your mineral bone density is. So that's the first problem. And that's probably a whole nother conversation we can have on how do you truly know if you've had this diagnosis, if you have weaker bones or not. But let's move forward and just assume that, okay, you've been diagnosed with osteoporosis or osteopenia. Let's assume that that is the right diagnosis and you have an issue that needs to be addressed. The first step you'll normally be offered is medication as well as calcium supplementation. Before you do either of those things, what's being shown to be the most important thing, and this is very unanimous amongst all the research, is exercise, weight-bearing exercise. Now, if you're someone who's still reasonably healthy, this could be anything like hiking, dancing, running. Just the more weight-bearing you do, the better, because bones work on a use it or lose it. The more we're on them and the more we stress them, the more bone strength lays down. If you're a little bit older or your health is really poor, you might start with very low-level aerobics, a stair-step machine, light walking, something like that. But exercise has to be your number one thing to add if you've been diagnosed with osteoporosis and osteopenia. Then let's talk about the deficiency side of it. So calcium is one very small piece, and some research is showing it's almost not even in the top 5 issues anyway with it, because a lot of us are getting calcium from the foods we eat, but if we're low on vitamin D, that's the magnet that gets that calcium out of our gut and onto our bones. So most women are actually deficient in vitamin D and vitamin C more so than calcium. So if you are diagnosed with these diagnoses, other than weight-bearing exercise, you must be getting either through supplementation or food in your diet or both, you must be getting vitamin D, vitamin C, vitamin K2, magnesium, omega-3 fats, and you can also add the calcium, but that's not actually the most important thing by any stretch. You also need to avoid processed foods and sodas, because they especially Coca-Cola and those kind of sodas, they strip all the minerals out of your bone. So even if you don't look like you have low bone density, you have weak porous bones if you're drinking that stuff a lot. And then you need to increase your intake of raw vegetables, because that's going to get you all the minerals you're missing. Juicing is a great way to get those in. If you're not a fan of having raw kale salads or anything like that, I'm not, I don't blame you. Fermented foods are also important as well. So if you're doing all of those things, hopefully you can avoid being prescribed any medication. If you are prescribed medication for your osteoporosis, one of the most common ones is Fosamax. You must do your own research. Now, again, our disclaimer, anytime we talk about medication, I'm not telling you you should or shouldn't go on a certain medication. All I can tell you is what the research shows. The research isn't very good on a lot of these drugs, and when your doctor prescribes it, any drug you're prescribed, always don't challenge your doctor. Don't go and be that person that starts a fight immediately just because you can. But you must ask to see the research and why you're doing it. A lot of these drugs are showing increased risk in certain cancers, especially a twofold increase in esophageal cancer is a big one with some of these drugs. The majority of them aren't actually improving your bone strength at all. They're actually worsening your condition because they fool your body into producing denser bones, so it looks better on the bone density scan, but actually weaker. In fact, we've had a number of patients who see us, and this is big throughout all the literature as well, who have fractured hips and their femur and other big bones that shouldn't just break because they're on these drugs, and their bone is just turning into this weak, chalky texture that just breaks. I had one patient not that long ago, and she was one of about probably 3 or 4 who have had the same thing, who did something as simple as trying to put clothes on. She was stepping into her jeans and felt an enormous pop, went into the doctor, they x-rayed her, and the surgeon said, your bones are terrible. And she'd been on Fosamax for years and didn't know. No one gave her the risks and benefits of this. So again, I'm not saying don't take medication for it. I'm saying if you can get your exercise and diet right and the right supplementation, the majority of you with that diagnosis will remove the need for those medications, but always go through the prescribing doctor if you're already on them and you want to start coming off them, because there's all sorts of horrible side effects when you do come off them. We will do another video talking in more depth about this misdiagnosis issue with this, but for now, for any of you who have been diagnosed, don't worry so much about that. Worry about what you can control. Get the exercise up, get the diet cleaner, get those supplements in that we mentioned, avoid the sugars, processed foods and sodas, and have a very serious talk with your doctor about risks and benefits if you are on Fosamax or any of these other drugs. So thanks for your attention. Please share this video if you think someone else will get value from it. And one last point, if you have been diagnosed with osteoporosis or osteopenia, that doesn't mean you can't see a chiropractor. In fact, we recommend that you do, because getting your spine functioning better by getting adjusted helps change the weight bearing, helps your body lay down better stress on the bones, because you can now go and exercise and do things better, which is all going to help you out. An adjustment is so gentle that it's not going to break a bone even if you're very osteoporotic. We change what we do just to even be extra safe, but it is safe, and we definitely recommend you get adjusted if you've been given that diagnosis. Thank you, and we'll see you next time.